Hello everybody, greetings from White Hills Dental, Goria, Kolkata. I am Dr. Krishnendu Chatterjee, consultant orthodontist. So today I bring in front of you a small clip which is representative of the technique of indirect bonding in orthodontics. So here the case that we are discussing is a lingual orthodontics case where fixed mechanotherapy in the lingual technique is being done with DTC brackets. And this is a small glimpse into how the indirect bonding is done. So as you can see here, we are bonding over here only the posterior segment of the left side, because we will be planning the extraction of the first premolar. The brackets that are being bonded shall be on the second quadrant, the second premolar, the first molar and the second molar. The patient has already undergone extraction of the third molars before the orthodontic therapy commenced. The teeth are already etched and rinsed and isolation is done. So here, as we can see, we have our indirect bonding tray with the brackets in place. The bonding tray has already been sectioned, and over here we have the section of the tray which shall go and fit in the second quadrant. The first premolar has been excluded from the arch. The second premolar, first molar and second molar are present. So now we can see that the brackets already are coated with some amount of composite adhesive material, and over that we are placing a very thin layer of flowable composite material in order to bond the brackets to the tooth surface. Now, after applying a very thin layer of flowable composite, we are just going to dab the area with a bonding agent using an applicator tip, just to confine the area of the adhesive material and also to evenly spread it. Now that we are done with this, for one last time before bonding, we will just dry the area, the field of work. We'll suction any extra saliva to avoid any patient discomfort or discrepancies in the isolation. We will snap fit the sectional tray, the area of which we are bonding, and once it is fit snugly, we shall cure the adhesive material using our regular light cure gun. So as you can see, because it's an indirect bonding technique, there are a lot of advantages that we can gain out of this technique. First thing being, we are doing the bonding in one step for a number of brackets together. So individual bracket positioning and bonding of individual brackets, which generally takes a longer time, is drastically reduced, so we reduce the chair side time. This technique can also be implemented in cases of labial bonding, where we are bonding the brackets on the front side of the teeth. So what happens is the brackets in their final desired position on the teeth are incorporated into this tray. So we do not have to individually spend time on each bracket, placing them on the tooth surface and removing the composite and providing the final position intraorally in the clinical time. So that time is taken up in the lab. So we are reducing chair side time, which is more comfortable for the patient and also for the operator. And as we are reducing chair side time, we do not have to struggle with isolation for that prolonged period of time. Also, exclusively considering lingual orthodontics, it is very important because we need exact precise bonding of the teeth, as well as because it's a lingual technique, it is very difficult to manipulate the bracket positioning chair side. So as you can see, after the curing is done, we have removed the tray. And the brackets are in position on the teeth. We'll just check if they are bonded properly, moment of truth. And it looks fine. The patient is good to go. Thank you for patiently watching the video. I would like to thank Dr. Mayuk Chakrabarti, my general dental practitioner, for his constant faith and support, and for also being a part of this video. Maybe in the future we shall come up with a long and more elaborate video on the same procedure. Thank you so much. Have a great day.